Thank you for joining us today. This is Chin Lee from Little Monkey, and you're here for our Parenting Talk series. As always, these are 30-minute interview with subject experts and issues that parents face. And recently, I shared a celebratory story on my social media about the fact that my abdominal separation decreased, and I was like, yay, all the work with my physical therapist, Marissa, helped out. And a lot of people actually started messaging me, asking me, what is abdominal separation and how do you decrease it? And why do you have to decrease it? So I thought this will be a good topic to discuss. So today I brought in my friend here, this is also my physical therapist, Marissa Liu from Pro Health, for the topic of women's health. What women needs to know pre and post pregnancy. So we have Marissa Liu here, who's a clinical Pilates instructor, diploma in clinical acupuncture, and a registered physical therapist. Hi, Marissa.
Hi, Jean. Thanks for having me.
So can you introduce us a little bit about your background as well?
Sure. So I was born in Venezuela. From a very young age, I was always interested in medicine. I came to Hong Kong when I was a teenager in order to pursue better education. So after obtaining a degree in physical therapy, I also obtained a diploma in clinical acupuncture, a certificate in clinical Pilates instructor, and a certificate in naturopathy, among other titles. So I've been working as a physio for 21 years, and now I focus more on women's health.
So let's just explain a little bit. Women's health, what is it exactly, and what does it really focus on? It's not like every single woman, right?
Yeah. So women's health is focuses on pregnancy-related issues, such as pregnancy back pain, pregnancy back and neck pain, or abdominal separation, incontinence. So because I've been working as a physio for more than 20 years, I've seen all sort of conditions, and I noticed that the lack of postnatal care in Hong Kong. So I felt that there's a great need to provide women with specialized treatment in order to meet their physical and emotional aspect.
Yeah, and I'm really glad that Marissa did, because the reason why I went to Marissa in the first place was during my second pregnancy, I started feeling pain. I think we're in like 4 months pregnant. And as we all know, subsequent or second pregnancy, the belly grows a lot faster. And with that, I started feeling pain. I was thinking, yeah, this is normal, because I remember feeling pain like on month 8, month 9 for the first pregnancy, and they all told me it's because the baby's heavy and everything. But then the pain got to the point where I couldn't sleep, and that's when I started searching. And you're right, there is only really a handful of physical therapists in Hong Kong that's focused on women's health. Now, for the women who don't know what it is, and I didn't know, you had to explain to me on our first meeting, what is abdominal separation? What is incontinence?
Right. So abdominal separation is when a woman becomes pregnant, their belly starts growing, and because of it, your abdominal muscles actually splits open and separates. So because of that, your core no longer is working, so it's not holding your weight. All your whole body weight goes to the back and presses on the nerve on your back. That's why it causes back pain. So then incontinence is also related to abdominal separation. The reason is because the abdominal pressure pushes down on the pelvic floor because there's no core to hold it up. So then a woman will leak every time they run, cough, or sneeze. So that's what we call stress incontinence.
Yeah, and a lot of times we think of that as something happening when we're old, in our old age, but that could happen a lot during pregnancy and even right after pregnancy as well. So I have a screen here. This is Marissa's information background. It's really cool that she's born in Venezuela, and this lady speaks Spanish fluently too. So that's really cool background that she has. And let me just show really quickly what she meant. So this is our core, and later on we'll go into how it separates. But before we do that, let's start from the beginning. Okay, so woman gets pregnant. What happens to her body during pregnancy? And then what happens right after she gives birth? And then what should happen a couple of months later? Because let's face it, right? Social media is the worst enemy when it comes to a woman's body. We see all these celebrities and people getting back into normal, like little tiny shapes right after giving birth. And frankly, we all know it's not normal, but it gives us this whole big pressure about it, right? So what we want to talk about is, other than during pregnancy, what happens to your body, and after birth, and a couple months after, what is considered normal? What is considered normal to go back to? And how long does that take for us to actually, for a woman's body to go back to normal, quote unquote, after a pregnancy?
Right. So during pregnancy, woman's body changes a lot. For example, their breasts start to enlarge, so their shoulders becomes a bit wider and they kind of rounded, and so that will actually change the way she stand or walk. Then because of the growing belly, their back starts to arch much more.
Yeah.
So in order to compensate for that, they start to walk funny like a duck, what we call a wobbly gait.
Yeah.
So they walk like
Especially with
that.
that big belly, yes, we water a lot.
Yes. And so that's a compensation. So for us as a physical therapist, we'll try to correct the posture or improve the posture as much as possible in order to prevent any complications. So as the belly starts growing, the muscle on the abdomen splits up.
Yeah. Can you show that one in the picture?
Yes.
Yeah. So this is that open
diastasis. So we call it diastasis recti, and which means abdominal separation. So the first one is an open diastasis. So it's a separation on the belly button. So that's a minor one. Okay. So then there's the open below the navel diastasis. So it's under the belly button, which is very separated. The third one is above the belly button, which is very separated. And then a complete open diastasis, which is everything from the top to the middle to the bottom, it's all separated. So all her muscles are separated.
Yeah.
So this is the way that we can classify abdominal separation. And depending on the severity, then we will adjust the treatment program, right? So
for women, I mean, we all don't have a machine to tell us right away, looking in the mirror, that we have this problem, right?
Yes.
Usually, I believe, based on my past experience and based on talking to other women, every woman should see a physical therapist after giving birth. Like, I think in France, it's automatic, right? But here in Hong Kong, I mean, we still have pretty okay healthcare, but we don't do that. But so I recommend all women should definitely go check it out after giving birth, after at least 3 months.
Yeah.
But some women, they don't think they have a problem until they feel pain, whether that's during their first pregnancy or after giving birth or a subsequent pregnancy. So other than feeling pain, like I think you mentioned to me previously, pain is one of the big indicators that something is wrong, right?
Yeah.
So, like, when should a woman see a physical therapist for these women's health issue? Other than pain, is there?
Well, actually, I think after giving birth, about a month or two, when everything is sort of under control. So if you have given birth naturally, you can see a physio after a month. If you've given birth via cesarean, so you can see the physio after 2 months when the wound is pretty much nicely healed. So what I do is, on the first assessment, is to measure the waist circumference and then measure the abdominal separation with my fingers manually, and measure it with the real-time ultrasound machine to see and confirm the severity of the abdominal separation. I think every woman after giving birth should see a physical therapist to understand the severity of the condition.
Physical therapist in women's health.
That's right.
Because I actually made the mistake. I actually went to someone in a panel, my insurance panel, to see about my back pain, and all he recommended was I do some stretches on my back. I'm like, what? Then I read up on it, and I read about Marissa's blog post and everything about what she wrote about what really happens, and that convinced me I really need to go see a physical therapist, even if it was out of my insurance panel.
Yeah.
What issue? If let's say a woman doesn't take care of this, I mean, for me, it was because my second pregnancy, I literally couldn't sleep. We're talking about sleeping 2-3 hours a night, sitting there, just laying back a little bit, because if I were on my side, pain shot up my leg, and I just couldn't even, like, there's no way for me to lay down. That was really horrible. And especially as the tummy, the baby belly started getting bigger, I couldn't sleep on my back as well. So that was, for me, it was needed, right? But if I didn't, and that was because the second pregnancy, I should have seen you after the first pregnancy. But for other women, other than pain and issues during a subsequent pregnancy, what long-term issue could they be facing if they don't get physical therapists, like just overall get their body back into shape after any pregnancy?
Right. So after the first pregnancy, most of the time the abdominal muscles are already separated. Okay. So that means that the core is not working. That means that all the weight is shifted to the back. That means that it's very likely they will have back pain, or any small activity could cause back pain. It also means that it could cause incontinence, stress incontinence. So if they do other activities such as running or jumping, coughing, sneezing, already causes leakage. Okay, so everything's related to the abdominal separation. Okay, so now let's say they don't take care of this abdominal separation, and then they have a second pregnancy, let's say. The second, yes, like you. Yes. So on the second pregnancy, they will notice that the belly grows really big, really quickly, because the abdominal muscles cannot hold it at all. So it's just expands. And then back pain for sure, because the belly is way too large.
And that was because you told me it was sciatica pain. It wasn't just that, it was like
sciatica pain.
The upper of my butt and the lower of my back, like that area was really painful. Every step I took, I remember it was
painful. Yes. Yeah. And so not just sciatica pain or back pain, but also pelvic pain, sacroiliac joint pain, pubic symphysis pain,
which is
right in the front of the pelvis, hip pain. So they're all related. Okay, so they will notice that on the second pregnancy, the pain comes much sooner, and their belly grows much faster, which it shouldn't be.
So my understanding, everyone keeps saying, oh yeah, it's your second baby, you're gonna get bigger faster. The reason is because we're too loose.
Yes.
Our core is not there.
Your core is not there. It's too loose.
Oh man. Okay.
So
that's the reason why.
So that's right. So if you take care of your body and you mend the abdominal separation after the first pregnancy, the second pregnancy, your belly will not grow fast, it will not expand fast, and you will not have back pain. Yes. So if we can prevent all sort of complications instead of waiting for it to happen.
Yeah. So I remember you told me that there was somebody who worked with you as well, who had pain, and she came to you, right?
Yeah.
And what did you do with her? I remember you mentioned that.
Yeah. So I had a patient that she had it's her first pregnancy, and she had hip pain.
Okay.
And she went to the doctor, and the doctor told her that to take Panadol to mask the pain.
Extended release Panadol. That's what my doctor gave me too.
That's right. And then she thought, well, it's not normal to take Panadol for 5 to 6 months until the end of her pregnancy.
Yeah.
So she thought that there must be something wrong. So she went to another doctor, which referred her to see me. And when she came to see me, I assessed her. She had abdominal separation. She had some issue with her hip, but I explained to her it's because of her abdominal separation. That's why she has hip pain.
That was the main issue.
That was the main cause of the problem. So I worked with her for 2 weeks doing Pilates, reformer Pilates for pregnancy ladies. And in 2 weeks, the pain was gone. So she no longer has hip pain and she never took Panadol.
But after 2 weeks, would she continue doing that? Because she hasn't given birth and the baby will just continue to grow, right?
That's right. So after those 2 weeks, the first 2 weeks was to help her get her core back. And then she's still continuing seeing me till now. She hasn't given birth and she's still coming 3 times a week to do reformer Pilates. So the benefit of it is we have maintained her belly to a certain size. The baby's growing, but the belly is not overly growing.
Not too fast.
Yes, not too fast. She no longer has back hip pain, and she noticed that she's more energetic, more active. She's able to do. She's able to walk for 3 hours without any problem. So this reformer Pilates not only helps a pregnant woman maintain her abdominal separation so that it doesn't get worse. After delivery, it helps mend the abdominal separation.
Because your core is stronger to mend it up.
Yes.
But also helps, I remember you told me during labor it helps as well, right?
It helps labor as well. If she plans to do a natural delivery, having a strong abdomen and having strong legs will definitely help for labor.
Yeah. So that's very key. And so it's good that I'm not the only one that when I had pain, my doctor gave me extended Panadol and told me to take that. And I asked her, like, what's the long-term, solution? The doctor's was the long-term solution is to give birth, to get the baby out of you, and then the pain should go away. I'm like, really? So I also was in questioning that. And then I think a lot of women who didn't feel pain in the first pregnancy most of the women falls in that camp. They didn't feel any pain pregnancy because we're pretty, healthy before the first pregnancy. But then afterwards, when they don't take care of the body and they're starting to feel, oh, I just thought, it's because I gave birth and so it's natural. I always have this pain in my lower back. Or now the second one is because, my body's more looser. They didn't know that they can actually fight it back.
Yeah.
So let's talk about how you work with these women, right? So you mentioned working with 2 weeks with this lady. I have some pictures here of this one of the pregnant. I was, I think I worked up to you until I was like 9+ months pregnant. I was really big. So it's okay still to come to Marissa when you're pregnant. She does work with you. It's pretty safe, right? As well, you know what to do. So yeah, explain to us what do you do with women when they're pregnant and after giving birth, and also what are some of the stuff that, like in the pictures, these exercises?
Right. So when a woman comes on, it's pregnant, first of all, assess her condition. We'll see how severe the abdominal separation is, and then I will tailor-made exercises, reformer Pilates exercises, in order to help her with her core. So
let me interrupt you there for a moment. So when you say you first assess, so you use ultrasound and you use finger. Remember, we lay down and
yes. So usually, if the woman is pregnant, I will only assess with my fingers. When the lady has given birth already, then I will use my fingers and the ultrasound machine to assess. Yes. So then after assessment is a tailor-made exercise specifically for her condition to mend the abdominal separation, because as you remember the previous photo, there's different type of abdominal separations. So that's the machine, which is the reformer machine. We use that for Pilates exercises. So those exercises are tailor-made. For example, if we want to focus on the upper abdomen, so we'll focus to do a lot more arms exercises. And you notice that she is in a kneeling position. When you kneel down, the machine actually moves. She has to use her core to maintain that position. So even though she's using her arms, her biceps to pull on the pulley, she is using she's also using her core muscles and her butt and her thighs. So it's a movement, it's a flow, but it also encourage other muscles to work together.
Yeah, I remember, well, when I was pregnant, I didn't feel anything after these session, but the pain was lessened, especially in my back, especially some days I had inflamed.
Yeah.
Unfortunately, from walking or just doing regular stuff like being with a toddler, when she was doing not really toddler, but still running around with her, I had to come to Marissa. She had to do, just some treatment for me. We didn't exercise some days. Some days she just had to do treatment because it got to the point where I was like 8, 9 months pregnant and I'm still in a lot of pain, right? But after I gave birth and I came back to Maritza, when I was doing the exercise with you on this machine, and the machine's right behind us, some week we'll focus on upper or bottom, and you'll feel the next 2 days after, I feel like the pain. I was like, okay, so the muscle, I worked up on top, or I worked up on the bottom, or I worked up on my arms and my back as well. Yeah. So I think this machine is really cool. I never knew about it, and it looks very scary at first glance. My favorite is still the laying down of this machine, where we work a lot of the legs and stuff and the arm. But on top of this machine, Marissa did give me workout to do at home. I think that really helps as well. That speeds it along. So you're not like with Marissa. This is not a exercise program. You're not with her every single day. She'll give you tailor out the whole plan as well.
That's right. So I usually give home exercises and expect them to do them on the days that they're not here. So mostly they'll probably be exercising 6 days a week, some probably twice a week with me, and then 4 days at home. Because you are trying to encourage the muscle to memorize the movement and to activate. So the better the activation, the better they stay strong and tone up. So it's very important that they do the exercises at home.
Yeah. And on top of that, we mentioned the incontinence, abdominal separation. You mentioned the C-section incision pain, breast pain as well.
Mastitis. So I work with women, and some of the conditions that I work with are, for example, breast pain and mastitis, cesarean incision pain, pregnancy-related pelvic pain, such as pubic symphysis, sacroiliac joint pain, hip pain, the related back and neck pain, and of course, the stress and urge incontinence.
Yeah, I think it's safe to say that if you have been pregnant before, you can check and see if your pain is related. Of course, most often the core part, that's definitely related to pregnancy, but if you have neck pain and things like that, you can always come and have a checkup with Marissa. And if Marissa doesn't feel like you need women's help, specific physical therapist, there is other physical therapists here at Pro Health at her clinic. Here's the full contact information. So Maritza's from Pro Health Sports and Spinal, and her contact, her email address, and her phone number, along with, she has an Instagram where she posts about the different topics affecting women, which I thought was really cool that I looked at and follow as well. So yeah, I hope this was helpful, especially for those who are just giving birth or looking at your second pregnancy, or even those who's giving birth already and it's been like your kid's 1 or 2 years old. I think, it's good to have an assessment to go see if your insurance paid for it. If not, how much you can claim back, because this is our health. This is our long-term health and something that will last us for a lifetime. Because for me, my biggest fear is being one of those older women who unfortunately have to wear like a diaper type underwear, right? Because we're having leakage problem every single time you laugh or you walk or just something, leakage problem. And so working on your core now is a big investment for the future to make sure we don't go through that issue. Exactly. Marissa, thank you so much. It's always a pleasure talking to you about these things. And I go to Marissa all the time for all health issues. Like right now, she's advising me to take some collagen pills for other issues that I'm looking at as well. So anytime you need help, Marissa's here for you.
Thank you. Thank you so much, Jean.
Thank
for
you.
having me.
Well, thanks, guys. Hope this has been useful. In the meantime, check out our Scarlett's blog and issue concerning parents. Our last one last week was really cool on conscious parenting. If you ever thought about it, of course, you have to really apply it and not just read about it. That's something that a lot of parents I find have troubles with. So we're looking at maybe doing workshops for that to help you out. But in the meantime, feel free to give me feedback whether these interviews are very helpful for you. Any topics for the blogs that you want Scarlett to investigate or research into as well. What other topics for me to interview the subject expert as. So until next time, thank you and bye.